When TCAP came out, they gave us kind of an overview on how to change things, how to start small, and kind of gave the power to us, to the staff nurses, because we are the ones with the patients, with the doctors, with the families, day to day.
What's your color?
Our status board is probably one of the first projects that we came up with, just trying to help out the nurses, make them feel more empowered to take control of their day. It consists of a red, yellow, green board. Every 2 hours, either the charge nurse or the desk clerk calls the nurse and says, "What color are you?" Green meaning I'm good, everything's flowing fine, I'm doing all right now. Yellow meaning, well, I got some things to do, but I'll be okay in about an hour or so.
Are you really red?
Red means I'm swamped, I got a patient with chest pain, the doctor's rounding, writing lots of orders, I got a patient being transferred, I'm just swamped and I need help.
Mary, what's your color, honey?
One time on this side, we had a whole team of nurses that was red. A whole team of nurses over here that was green. I looked up to the board and saw that and said, let's go help Diana's team. And a whole pack of them came over here and just said, what can we do to help? On their own, just helping each other. And it still gives me chills to tell that story.
Okay. Okay, thank you.
One thing that we found is to try and identify patients who are at risk for falls. Most of our beds have bed alarms on them and have some ruby red socks. And so if someone's wandering out in the hallway with these ruby red socks on, we know that they're a fall risk, and then we know to go in and intervene and guide them back to their room.
Hello.
On our TCAP unit, we have a whiteboard, and it's a dry erase board that's in the patient room where we identify who the nurse is and who the clinical assistant is. The biggest place on the board is for the question, what is the most important thing I can do for you today? And the patients are floored. They just can't believe it. They love that. I love that.
What patient number do you have? 55. She's a 91-year-old female.
Multidisciplinary rounds is kind of a project I've been working on that I've been very close with. We pick 1 or 2 patients that are real complex, and we get together a little team. There have been times that we brought the families into it, and they really enjoy it because they feel that they are heard and they're telling their story and their wishes for their family member. What we can do in putting all these heads together is to try and make things better for the patients in order to get them discharged.
Let me put that on your recommendation.
Sure.
Hi, this is Annie on 4. I need a CRT in 455.
With our critical response team, if a nurse is feeling that just something's not going right with a patient, they can call a critical response, which is an ICU nurse that'll come up and assess the patient, and a respiratory therapist. It's 2 new eyes looking at a problem. The role of the Express Admit nurse has given the autonomy of that nurse to have more time to take care of that patient that came in. Their goal is to take care of that patient and get that patient settled and processed through the system. They don't have any other patients that they're attending to at the time.
Okay, let's go to ICU then.
Well, how was your night?
It was pretty good.
It was pretty good.
Now, with the TCAP unit and the changes that we've made, we spend over 60% of our time at the patient bedside, or in what we call value-added care. We have clarification of what's going on. We have time with the patient. You develop a better relationship with them. They feel like they're listened to. They feel like they have a say. So are you doing okay? We started TCAP here, and when it was time to cut back and simplify my life, the obvious choice would have been to fall out of med-surg, but there was no way. There was no way that I would leave here. It was too exciting, and it was too groundbreaking and empowering. So I actually chose the job that paid the least amount of money, but gave me the most satisfaction. I've been a nurse for years and years and years, and this is nothing like anything I've ever seen.
You are so welcome. I'll come back and see you in a minute. Okay. All right.